Welcome to Capital City Specialty and Emergency Animal Hospital. We are the largest specialty animal hospital in Ottawa by the number of specialists. We opened in March of 2023, and since our opening we've grown from 58 employees to over 160 employees in just over 12 months. We're also the equal largest specialty animal hospital in Ontario and the equal third largest specialty animal hospital in Canada. We have 16 specialists in 9 different specialty fields, including surgery, anaesthesia, critical care, medical oncology, dermatology, internal medicine, cardiology, dentistry, and ophthalmology. We also currently have active searches for a second cardiologist and a second dentist. In addition to our specialists, we have 18 emergency and critical care veterinarians, which with the specialists provide 24-hour care, 7 days a week, all year round. One of the things that sets us apart from many other specialty hospitals, particularly within Ottawa, are our intern and residency programs. We have 3 rotating interns, 1 surgical intern, and 1 small animal surgery resident, all of whom were our top selections in the veterinary internship and residency matching program, a fact that we're very proud of. We also filled positions of a small animal internal medicine resident and dentistry resident from within the hospital as a self-sustaining program to maintain that we have this specialty coverage. There are a number of other things that sets us apart from other hospitals in the region and in the country. One of them is our social worker. Dr. Michelle Lem is both a veterinarian and a social worker, and we employed her from the very start to provide support for our owners that are making difficult decisions, whether it be a challenging decision to proceed with surgery or the decision to proceed with euthanasia. She also provides supports for owners following euthanasia of their pets. And very importantly for us, she provides support for our staff and teams. So she provides, through her work, she provides a good working environment and good work culture within the hospital, something that we wanted to foster from the very start. There are other things that set us apart from other hospitals in that we have 2 fellowed surgical oncologists. Both myself and Dr. Sarah Boston are the only fellowed surgical oncologists in Ottawa, and we're 2 of 5 in all of Canada. So we provide excellent care for patients with surgical cancers and coordinate with our medical oncologists and colleagues from around Ontario if radiation oncology is required. We also have 3 fellowed oral and maxillofacial surgeons. Myself, Dr. Sarah Boston, and Graham Thatcher are the only fellowed oral and maxillofacial surgeons in Ottawa, and we're the only non-academic hospital in the world that has 3 fellowed oral and maxillofacial surgeons. And this is reflected in our caseload, in that we have a number of oral tumours that we treat from within Ottawa, but also as a tertiary referral from all over Ontario and Quebec, as well as the Maritime provinces and internationally, with cases relatively regularly from the USA, and also we've had some cases from international locations such as Vietnam and Dubai. We also have an active internal and external learning program. We have morning rounds, which are compulsory for all DVMs, specialists and ER vets. And that's an excellent way of communicating the status of our patients and transferring any patients from overnight to specialty services. We have monthly morbidity and mortality rounds, which also includes Schwartz rounds, which are run by our social worker, Dr. Michelle Lem, which provides internal support for the emotional well-being of our staff. We have monthly hospital journal club where journals, articles are presented by both ER vets and specialists. We have service-specific journal clubs which are typically run weekly, and a number of our specialty services run those journal clubs. For our external program, we have continuing education topics every month or every second month for referring veterinarians, and every alternate month we provide continuing education for technicians from our referring hospitals. We have a surgery newsletter that's published every month, and in addition we have live feeds from our surgeries that provide continuing education for our local vets as well as vets nationally and internationally. Our hospital is located in a very convenient location just off the 417. We're the only hospital, specialty hospital on the west side of Ottawa, and the west side is one of the growth areas in Ottawa, and we provide access to patients in all the way east to the Maritimes, locally to Orleans. It's only a 20-minute drive along freeways, and easy access off the Terry Fox exit to Capital City. Because of a number of clients driving in from Kingston and other locations, they often have to stay overnight and for their patients, and we have a number of hospitals, pet-friendly hospitals in the area to accommodate these patients and owners. And now for the hospital tour, we'll take you on that. This is Capital City Specialty and Emergency Animal Hospital. We are located at 747 Silver Severn Road in Kanata, one of the suburbs of Ottawa. We're in a industrial commercial park, and we're part of a 9-unit building. We originally bought 5 units, totaling roughly 17,000 square feet. But due to our growth, we purchased an adjacent unit, so now we own 6 units of the 9 units for a total of 22,000 square feet. We're in a complex close to Costco and Home Depot, and within the complex, as you can see here, we have lots of car parking spots available, also car parking spots at the back of the building. We have a number of commercial entities around us, from healthcare, including dentistry and physiotherapy, to a bakery, a distillery and a brewery, as well as a gym, a Mavati gym behind us. So lots of things for both our staff and clients to enjoy while they're at Capital City Specialty and Emergency Animal Hospital. And as you can see, a great facility with plenty of space, designed by a veterinary specific design and builder, and more importantly designed by specialists for specialists to accommodate all the equipment and services that Andy, Graham and I dreamed of in a specialty hospital. Coming through this area, see it's all soundproof lights, and here's our reception. Our team working hard on a Sunday. We're just going to walk through the main doors here. I'll show you some of the consult rooms from behind. So this is our pharmacy. This is kind of the clinical area, the hallway behind. On the right there is the surgery tech area, and in the far aspect is the dermatology tech area. We have 10 consult rooms in this area. Most of them are standard size. This is one of the surgery consult rooms. As you can see here, we have COVID as our AI system all set up in these rooms. There's the seating area for the clients. We come through here and see one of the larger consult rooms. For dermatology, this is the dermatology area. You can see here. And this is Dr. Lowe's consult room for dermatology, and the dermatologist, Dr. Ward, this is his consult room here. This can be doubled up as a euthanasia room, comfort room if required. We have these double doors here that provide separate exits for bereaved clients. And each of these rooms is set up for the dermatologist. As you can see there, microscope is there and everything. Now we're just going to go through back along this hallway. Since we've had the expansion, we've opened up from 10 consult rooms to 18 consult rooms. And the expansion, we have to take clients through this hallway. So they come out of the reception area here, and they're walked along through this area, past the consult rooms, into the expansion area here. And this is our core values. We go through here to exam rooms 11 to 14, which are dentistry and cardiology, up in this direction. And then in this direction, we have two more. This is ophthalmology through here. This is Dr. Feigel's room. I'm just going to walk back around to this area here. So these are our other consult rooms. This is Dr. Michelle Lem's social work room. And here. So she's a tremendous asset to our hospital. And then this is the second consult room, our comfort room, again with a, or third comfort room, again with a separate exit for clients that are obviously having to undergo recover from euthanasia, and the comfort area. So there are consult. So this is the back part of the new build, the sixth unit that we added on. This is our rotating intern area where they get some privacy and able to make their calls. We're just moving toward the back part of the new area. So this primarily houses the new cardiology unit and dentistry unit. This is where cardiology technicians do all their work, and this is Dr. Whipp's cardiology suite. Currently it's a rather large room, but it's designed to be divided into two rooms to accommodate two cardiologists, which is an ongoing aim of ours. And then to the dentistry suite. This is the dentistry area. They can see into where Dr. Matt Meals, our dentistry resident, and Dr. Graham Thatcher, our dentistry specialist, do all their work. So there's 4 separate tables with cages here. So this is, as I said, where they do all their work. And this is also designed to accommodate a second dentist, so we can have 2 board certified dentists and their resident working independently at any one time. And you can see here that we have our treatment area where we do focuses, treat our incoming patients, and then kind of triage them to where they need to go. We have our whiteboard system up here, which keeps track of all of our patients, where they're at, what treatments they need, and keeps our treatment teams on track for that. And so here's some housing here. We're just going to go through into the ICU area. One thing I wanted to point out though, there's some oxygen cages there, is this room here is called the bubble. This is where our referring our emergency veterinarians and other staff do their computer work. We'll just come through and have a better look at that. So the The nice thing about this room is it does provide some quiet, but we can also see, here's a bubble, we can also see out into the treatment area as well as into the ICU here. So it's a very effective place for veterinarians to do their work, but also continue to see what's going on in both areas. It's now a nice ICU. We have both runs and cages in our ICU. It's kind of a U-shaped design, and there are cages. We have more runs at the back here. And as we work through, we went through the U part of the design to recovery area, consultation area, and more cages. And let's walk through these automatic doors. And that takes us out of ICU. So directly from our treatment area, we have our first radiation suite, our radiology suite, just where this red light is on. So this is for use for both surgery and the emergency team and any other team that needs it. Now we're kind of moving into the surgery area or the anaesthesia area. This is where surgery and particular anaesthesia techs do all their work, draw up all their drugs, make up their anaesthesia plans. Directly to the left here we have our special procedures room. This is where dermatology does their video otoscopes as well as their dermal testing. Internal medicine do their scopes, and we do occasionally do electrochemotherapy. So it's a general purpose room for where special procedures are done by our specialists. And then this is our induction room. We have 4 tables and to induce all animals ready for surgery. Typically we have 2 surgeons operating from Tuesday to Thursday and 1 surgeon each on Monday to Friday. From the induction room we can go into our second radiology suite in here. So we've got use of both this one and the first radiology suite. Or we can go into our CT scan here, just a 64 slice CT scan, so very fast and effective. And this is our CT control room just in here, which is where our CT technicians do all their work. So past the fluid warmer, we're just going to go into the surgery room itself. This is the scrub area, separate to the surgery area. We also have a separate stock room for surgery, which is very convenient. And then when we come into the surgery area, in total in this area we have the sterile preparation area and 5 ORs. So it's going to show you the sterilisation prep area. We have a number of packs, the big autoclave, and a spare autoclave in case there's an emergency. And so we have 5 ORs. We'll just take you through each one. The first is OR1, which is where we do orthopedic work, mainly scopes with the arthroscope, or laparoscope, or thoracoscopy or laparoscopy. So a nice large room to do that. We have pass-throughs in all of these rooms that communicate between the 2 rooms. And we also have these 86-inch monitors that connect to a camera in the light handle, so we can have a magnified view of our surgery, which is really helpful for visitors, and we can also live feed those, which we're actively doing at currently. This is a closer look at our in-light camera system that we use with our surgeries in our ORs. So this is a system by Steris, a large surgical company. And here you can see myself, Dr. Juliet Slipchak, doing a surgery in the OR with surgery resident, Dr. Jesse Lebelski. And you can see the big 86-inch screen behind me showing a magnified view of what we're doing in surgery. And so this is a real time, and it's an excellent resource for visitors to the hospital to be able to see what we're doing in surgery on a big screen monitor, and much better view than you even see in surgery itself. It also gives our anaesthesia and surgery technicians an idea of where we're at with our surgeries and get a better understanding of what we're doing in our surgeries. And if need be, we can show up close views for our internal medicine and critical care specialists as to what we're finding in surgery. More recently, we've used these for live feeds onto social media, specifically YouTube. And so what we're doing now is live feeding these surgeries to YouTube, so referring vets can see surgeries on their patients in real time, also later from the saved videos. But we can also get subscribers from around the world. So we have a number of subscribers in North America, in South America, Europe, Asia, and the Middle East, watching these surgeries in real time. And so very beneficial for their education. We also use it in our own continuing education courses that Dr. Sarah Boston and myself particularly give. And it's a good teaching resource. So very happy with this. I'll just give you a small segment of what one of these live feeds look like, and the information that we give to our viewers.
In that we'll get a very good chance of getting a complete excision on that. I'm just using proportional margins here. Proportional margins are where the lateral margins are equal to the
So here you can see what a small segment of that video looks like, but we do do a live feed of the entire video from start to finish. And so coming down here, you can see our gas sterilizer in the far corner there. This is OR2, this is the smallest of our operating rooms. We tend to do, Dr. Feigl, our ophthalmologist, does all her ophthalmology work in here, as well as surgeons do smaller procedures like anal sacculectomies, those kind of things in here. Then we're going to spin around here to OR3, which is our fluoroscopy room. So that's a fluoroscopy in there. We do scopes in here. There's that scope tower in the far corner, but we also do all our intraoperative fluoroscopy, whether it be for orthopedics or Dr. Whip doing his cardiology work in here with intraluminal stents, those kind of things. And again, we have the pass-through here, and all of these rooms, as I said, are fit up with these monitors that can do intraoperative live feeds of videos, as well as showing those video feeds on the screen for the benefit of many visitors. And the last two, 4 and 5, are basically carbon copies of themselves. They are more soft tissue rooms, and we have 3 ligature units and 1 harmonic scalpel unit, and top of the line anaesthesia machines from Mindray, which have both isoflurane and sevoflurane vaporizers, and inline ventilators and monitors. Pass through there. Let's go into the last OR, which is OR5. Again, pretty similar to the last one you saw, where we mainly do soft tissues. So between the surgeons, we do 4 to 6 cases each a day, so between 10 to 12 cases a day, which keeps the anaesthesia team hopping. And then once they're out, we take them into recovery. Sorry, I didn't turn the slide on, I'll just turn the slide on now. So this is our recovery area for small dogs and cats over here, and large dogs over here. Each of these runs have heated floors to aid in their recovery. And once they're recovered sufficiently, then they're moved over to the intensive care area. This is the last aspect of our tour. We're going to walk past the ICU on our right, the recovery area on our left, and this is our first ultrasound room where internal medicine do most of their ultrasounds. Specifically designed tables for that. And then we're just going to walk further down the hallway here. On our right is our laboratory with fume hood and HESCA and Antec machines. We have a full-time laboratory technician that samples everything, so take the pressure off on the floor technicians. And then directly opposite that is our medical oncology area. This is their work area. They have some cages and runs in there, and the chemotherapy room with obviously dedicated fume hood for preparing chemotherapy drugs. Let's walk out of that room. This is more area for the medical oncologists, and this is the second ultrasound room just here, which is where most of the medical oncology ultrasounds are done. Again, the same table. And just to the left of that, we have our isolation area. So this is a true isolation, in that everything has its own individual dryer and washer just here, own prep area, and the room is closed off here with all of the requirements that you can see here. And everyone needs to get dressed when we have a patient in here. We don't currently have a patient. They also have direct access to the outside there, examination room and everything else. So there's everything's dedicated to this area. So a nice isolation area, even with oxygen cages there, run and small cage. So we have room for a number of patients if need be, of varying sizes. And now we're going to go around the back hall. This is the hospitalization area and general functioning area. In here we have the small dog ward and the cat ward. And we're going to walk further along here, where we have the ward for small dogs and large dogs if need be, which is exactly opposite the kitchen area. And then beyond the kitchen area, this is our server room in there. We have the large dog ward, which again has direct access to the outside, to the walk dogs. Let's wake them all up. So that's the dog ward. And here we have our oxygen generator room. So our oxygen generators, let's make it like this. We didn't really want the problem with oxygen tanks, so we have these oxygen generators to supply the hospital's oxygen requirements. And we're just completing our tour here. This is the back entrance through here, and this is the hallway that leads to the reception. The lunch area and the boardroom. So we're just going to quickly go down here. We have our bathrooms and showers just here and to our left here. And then the offices on our left here. This is the communications room, the surgeon's office area, and the internal medicine office area. So as we go down here, we have access to ICU through this door, and then the general treatment area through this door on our right, just here. So our general treatment area and our boardroom on the left there, and then this takes us back through to the front of the hospital. On our right to the reception area, and on our left to the new wing with the administration area, cardiology and dentistry suites, and the 8 extra consult rooms. This is our boardroom. We use this boardroom for a number of different functions. The most common use is for morning rounds, where we discuss all of our overnight cases and in detail. It's compulsory for all of our veterinarians to attend. It seats up to 60 people in this room, so we have monthly referring vet continuing education meetings here, as well as our internal continuing education such as hospital-wide journal club, as well as morbidity and mortality rounds, and general meetings as well. So it houses up to about 60 people. So now we're just entering in from one of the staff entrances, the main staff entrance from the front in the original building. And so we have a cubby area where staff can place their personal belongings during their shift. And then we have our lunch break area, which has a lot of natural light and soundproofing designed lighting. We provide free coffee and hot chocolates, and we have this snack bar providing frozen and fresh foods and snacks and drinks for our staff. And there's our team up there. We also developed the mezzanine space in the new unit, so we have more room for managers to work in a quiet space. So this is the management area with separate offices for managing director, the partners, finance, and then the emergency and specialty teams.